My name is Rebecca. I'm from Cancer Support Community South Bay, and this workshop is presented through SBSC, which is South Bay Survivorship Consortium. This includes Torrance Memorial Medical Center, Torrance Memorial Physicians Network, Cancer Care, California Hematology Oncology Medical Group, Cancer Support Community South Bay, American Cancer Society, Beach Cities Health District, Kaiser Permanente, South Bay, and Harbor UCLA. So this is the second program of the year. And as with all our programs, we are recording this and it will be posted on the SBSC website in about 2 weeks. So for the consortium, in 2009, several members got together to see what we can do to provide survivorship education in South Bay. So today's program will be focusing on cancer-related PTSD, or post-traumatic stress disorder, and what happens when a person is diagnosed with cancer. In addition to learning to recognize signs of PTSD, we will learn life-altering mind-body skills that can help bring the nervous system back into harmony when it becomes overactivated by reminders of cancer. In addition to learning effective breathing and meditation skills to cope and manage stress, Brittany will also discuss treatment and prevention for CRPTS. So for some Zoom etiquette, you have quite a few people on this call. So we would appreciate it if your microphones are muted in the presentation, and we will mute you, and we'll mute you as well. Let's see. If you have any questions, please use the chat function to type it in. There will be a pause point about halfway through when Brittany will ask if there's any questions, and I'll be more than happy to read any questions that were in the chat. And also, instead of a sign-in sheet, we're using the participant list to check for our attendance. So if your login name isn't your full name, it's something creative, like a nickname or a phone number, please let Miriam know by emailing her. I will put that in the chat right now, or you can also directly chat Miriam to say, hey, Flowery Girl is whatever, whatever your full name is. That would be greatly appreciated. As you may recall, we are committed to getting your feedback on each of our programs. So in the world of, COVID-19, instead of paper evaluations at the end of the program, an evaluation will pop up onto your screen. There are 8 questions, very short, less than 5 minutes. Please answer them and press submit when you are done. We are here to support you, and we can only know how to support you if we hear from you. So your answers are confidential, so no one will see your actual response, like what response came from who, just how you responded. So Miriam, if you're ready, let's try a sample question. So if you didn't know, today is National Walking Day, and we thought we would like to find out what your favorite place is to be one with nature. So the question is, what favorite place, to be one in nature is, and there's a couple of options. If you can just click which one you prefer and then press submit. Ooh, I can see the actual polls, and they're moving. Let's give it a couple more seconds. Is it the beach, the park, around the neighborhood?
Are you putting this in the chat, or how is this happening?
So on your screen, a poll should have popped up, and you can choose either. Oh, it hasn't?
No.
Oh, I'm sorry, Judy. I'm not sure. Well, it was, you could think of the answer. The responses are beach, park, or around my neighborhood.
Okay.
I'm not sure why you don't have that. It's popping up on others, so I'm not quite sure why.
I don't.
Yeah, it's a sample question, but thank you for letting us know, Judy. Hopefully for the evaluation, it does pop up. and let us know if it does not. But let's end the poll and see what their responses are. So 57% said the beach, 25% said a park, and 18% around my neighborhood. I think that makes it especially where we're at, but with gas prices, I know around my neighborhood might be a little bit more relevant at this time. But thank you so much for participating in that. We will also have a handout with additional resources on integrative and mental health that we posted on the webpage at torranceMemorial.org/SBSC. I'm going to put that into the chat right now. Along with the link to the program video. It'll be emailed to you if we have your email address when you registered and if we know who you are. So if your name is not your name and it's Flowery Girl or something, we don't know that you attended and you may not actually get this link. So our next program is May 25th, and it will feature Pam Braun, author of the popular cookbook, The Ultimate Anti-Cancer Cookbook. She'll be talking about applying the latest cancer and nutrition research findings to everyday life. And then we'll go on break for the summer and return with more programs. Dr. Philip Chang from Cedars-Sinai will teach us about cancer rehabilitation and post-treatment side effects. And our final talk will address the emerging role of immunotherapy in primary treatment and post-treatment settings. So again, please give us your feedback in the evaluation at the end so your opinions can be heard. So finally, thank you. I'd like to thank the consortium members who helped put this program together and those of you who give us your attention and valuable feedback. And without further ado, I would love to introduce our workshop speaker. Brittany Rudinica is a licensed clinical social worker with additional certification in oncology social work and also registered yoga teacher. Brittany is passionate about integrating her enthusiasm for integrative health into her work with cancer patients, which she is currently doing at Torrance Memorial Medical Center. Born and raised in the South Bay, Brittany received her BA in psychology and creative writing from University of Arizona, taking a semester abroad to study at the University of Hong Kong. Since completing her master's of social work in mental health and gerontology at UCLA, her career has involved working with both adults and children. Brittany is also certified as a yoga teacher and a meditation and breathwork instructor. She combines her unique blend of skills in counseling and teaching with mind-body exercises to help her clients develop mindfulness and self-compassion skills. Brittany's hope is that these tools will empower people with cancer to know how to bring their minds and bodies back into balance at any time. To keep herself balanced, Brittany spends a lot of time with family and friends. She enjoys walking on the beach. She's another fan of that, practicing yoga, and is a regular at the Redondo Beach Farmers Market. Thank you so much, Brittany, for being here with us today.
You are welcome. Thank you so much, Becca, for that introduction. And thank you so much, everybody, for being here today. I'm seeing so many familiar faces and names, which is so exciting for me to feel the community that has been built virtually during this time. Why don't I just pull up my PowerPoint here? We are going to open up the topic of cancer-related post-traumatic stress disorder, as well as post-traumatic stress. We'll get into the difference and how to bring our mind and our bodies back into balance when we feel triggered or overwhelmed or in the middle of crisis. So I have this beautiful image here. If you might notice, it's some broken pottery that's been glued back together. And I've oftentimes seen this image when I have taken other workshops on trauma. And it actually, I think it's beautiful because the concept of gluing broken pottery back together with gold paint is actually a Japanese technique called kintsugi. And the whole concept behind it is that sometimes you don't always realize, it says here, the full potential or the beauty until you go through tough times. So I know that that could be a very general interpretation, but to me, it means that even when we may feel completely broken or like things have fallen apart, the way that we mend ourselves, repair, grow, weave in the gold paint, is kind of what makes us who we are. So, today we're going to get on the same page about defining what trauma is, talk about what cancer-related post-traumatic stress disorder is, as well as post-traumatic stress. We're going to be talking about trauma through a lens of the physiology of what actually happens inside of our bodies when we are confronted with a traumatic stressor. So that the point of that, and while I'll be giving you some of this more physiological information, is so that you could understand why we're going to implement some of the techniques that can help down-regulate or calm your body during hard times. We're going to talk a little bit more about education on prevention, what's been proven in the literature to help prevent developing a post-traumatic stress disorder, and interventions for how to help that are also evidence-based. Finally, in the second part of this, we're going to round out with some beautiful meditation, breathwork practices, and mindfulness exercises. So, I'm excited to get started with you all. And so we're just going to kick into it right now with a few deep breaths and a grounding practice, because before I give you all the education and keep talking about this word trauma, which in and of itself can be very triggering, I want to make sure that you have a place to come back to if anything I say becomes like too much or does trigger you. So we're just going to get started by setting our pens and our paper aside, gathering our full attention to the screen in front of us. Just make that eye contact if you are on your video, but really just drawing your eyes to the screen for a moment, please. And we're just going to start to notice our breath. So your eyes may be opened or closed, whatever feels more safe, comfortable, and accessible for you right now. And we're going to make sure that wherever we are sitting or lying or standing, that we have our feet or our seat, whatever is touching the floor beneath us or a surface, we start to feel connected. So if you're on your feet, you'll just start to tap them back and forth. And same if you are sitting down, start to rock your hips back and forth so that you start to feel the connection of your bones, of your sit bones to the chair. And start to allow the body to become heavy. Really taking a minute here to lengthen the spine. So we're going to make sure that our shoulders are stacked over our hips and that our ears are stacked over our shoulders, allowing extra length all the way through the crown of our head. And from this space, we're going to start to take a few conscious inhales and exhales. And we're going to take 3 inhales and exhales all together just to start class today. So on your next inhale, we're going to breathe through our nose. And on your next exhale, breathe out your mouth. big inhale through your nose. And exhale out your mouth. One more time, inhaling through the nose. And this next time, we're going to take a big exhale and release.
All about meditation. I know you need to do that.
So now we're going to blink our eyes open when you feel ready and comfortable, and start to move our head in all directions to start to notice any shapes, bright colors around you. And really allow yourself a moment to feel fully oriented in the present as you draw your eyes back to the screen. So I hope, you could come back to this space at any time again and take 3 deep breaths if ever needed. So with that, we're going to talk a little bit more about what you came here to learn about is what is trauma? What are we talking about? So I think it's important to know that an event that may be 2 people may experience the same event, but they both may not develop a post-traumatic stress disorder from it. So what I mean to say by that is that everybody experiences life events a little bit differently, and the way that they move through and cope with those experiences may change person to person, and it may largely change based on what their coping skills are, how they seek support, their physiology, their history of past trauma, their general level of anxiety and stress. So I just want to start by saying that there are a lot of different personalized factors into what comes into what someone brings into a potentially triggering event. And I say that because when someone receives a diagnosis of cancer, people will oftentimes have, some similar but potentially different reactions to the illness and to the diagnosis. But you do see kind of over time that people, at least what I've seen in my practice, have different ways of coping with it. And we'll get more into some of the coping styles. But really what kind of defines something as becoming traumatic is when the event is bigger than our ability and our resources to cope with it. So if you think of the pandemic as well, when we first started with COVID pandemic, the threat was so big, right? And no one really had the wherewithal to know what was going on, and many people did not have the resources to be able to cope with the event, which did cause it to become very traumatic for many. So if we think about it, when someone receives a life-changing diagnosis, most people aren't prepared for that. Even if you know that there's a history of cancer in your family, it doesn't necessarily mean that you're ever ready. And I've heard people say this many, many times. Like, I should have known, can I prepare? And it's, no, I think the answer is that we do what we can in the moment to survive and get through. But so essentially when we're triggered by overwhelming emotions and unable to bring the mind and body back into balance is when something is considered to be a traumatic event. So again, the physical and mental shock of receiving a diagnosis that is life-threatening or perceived as such is very important in kind of defining the trauma related to cancer. So even though you may receive a diagnosis that your doctors say is hopeful and treatable and all of those words, the C word is still incredibly loaded, and you may have a ton of associations with it that elicit a very understandable fear response. So in and of its nature, the C word of cancer can be incredibly triggering for most people. And I want to bring up that oftentimes a diagnosis comes so shockingly and unexpectedly that our lives are going in one direction, and it's kind of like the rug gets pulled out from under you. And what I mean by that is that our sense of safety and security in the world, as well as our sense of safety and security in our bodies, can be incredibly threatened. So let's see here. So I bring this up because of this intensely distressing experience of a diagnosis, of waiting for results, of going through a new treatment, unknown. Our body is in a hyper aroused, stressful state oftentimes. And I don't know if anybody's heard, I'm sure some people have heard about the fight, flight, and freeze response before. But essentially, this is an explanation of the body's primitive stress response that has been happening ever since caveman times for survival purposes. So the theory behind the fight, flight, and freeze response is that our body has learned to rev itself up with adrenaline and energy to be able to protect itself in the wild if something like a tiger were to, try and attack it and become the threat. So in that situation, if a tiger is coming after you, there's a couple different options. The person can fight the tiger, they can get out of there and run away from the tiger, or in some situations where there's an inescapable threat, you freeze and kind of shut down. So those are three of the responses that are kind of used to explain what's going on in our nervous system when we're faced with not only a tiger, but any kind of a real or perceived threat, particularly when they're real or perceived to be life-threatening. So this system, the stress response system that happens in the body, happens automatically when there is a threat. It's part of our autonomic nervous system, our automatic nervous system that we'll see a graphic in a second. But what actually happens during that time is that our pupils dilate, we're ready for action, we've taken more oxygen, our muscles are ready to go, we're prepared for battle. You may be more acute to hearing things. All of our senses are fired up, and our cortisol goes up, our stress hormones. And on the flip side, the things that go down are our digestive system. We're like not focused about digesting our food properly when there's the tiger in front of us, right? We're not in rest and digest mode whatsoever. We're in the opposite. We're amped up and ready to prepare for battle. So I give that long example to help you understand maybe a little bit about what the body goes through when it is faced with a threat. The whole thing about it is that it's not such a bad thing that our body goes through that hyper aroused state to protect us, because that's the function of it. The problems start to occur when our body's never able to come down from it. So if, you think of any example, I'm sure there's even work deadlines that may be triggering, but if it's something that is so in front of our face and threatening as a diagnosis, as starting a new treatment, as surgery, as waiting for our PET scan, we're waiting for some really important information that can give us a sense of hopefully more security or something. In that process, our body is so hyperactivated that until we're able to release the energy and to come back to safety, sometimes we stay in that up place. And so this is kind of, some people have, let's see. So it's kind of an example of the body being dysregulated. And the key is to safely discharge the energy, to get rid of the energy once the threatening event or the immediate threat is over. And So I think that one of the hardest parts is that I've heard a lot of people say with a cancer diagnosis is that even when they're post-treatment and survivorship and they're told, hey, you're cancer-free, oftentimes I have people tell me they have very mixed reactions to that. And it's hard to feel that sense of safety and security and trust in their bodies after there's been such a lack of the ability to trust our bodies and to feel safe and to really have that security and that threat, the very real threat. So the physical and mental shock after receiving a diagnosis, sense of security is threatened. Let's see, I went to the wrong one. And so I think that it's important to know kind of what is going on in the body. As I mentioned, again, the sympathetic nervous system is when we're hyperactivated. However, the parasympathetic nervous system, the pause part of the automatic nervous system, autonomic, is when we start to downregulate our nervous system. It's when our pupils dilation goes down, when our heart rate and blood pressure go down. We start to digest food again. Our glucose isn't all over the place and our cortisol levels go down. So the question is, how do we discharge some of this high energy, whether it's in the moment of crisis or whether it's a memory of the moment of crisis when we're later triggered and we still feel that tiger, that threat in our room? So we will be getting into those exercises for the parasympathetic nervous system. So I do want to mention that trauma. I mentioned a lot about the sympathetic nervous system, about being the fight and the flight. However, it's important to know that the freeze part of the nervous system is when people feel shut down or dissociated, bored, apathetic. It's kind of like your body, though. You're not being, quote, lazy, as some people may say, or not motivated. It may be the fact that there's actually too much energy going on inside of the body. And like an electrical circuit, like if you have too many blow dryers and microwaves plugged in, it kind of goes out and could shut down. On the other side, people may feel really anxious and hypervigilant, jumpy, defensive, kind of like a balloon that's about to burst. So that's when we're keeping all the energy on the inside. I have this quote from a woman on powerfulpatients.com, Abigail. For men and women enduring the trauma of cancer treatment, the trauma is never over. Reminders exist everywhere, ready to pop out when least expected. So I want to acknowledge that we don't know when we're going to be triggered. Sometimes there are times that are like anniversaries or upcoming mammograms or scans that we could kind of know or have become, we've learned our patterns in our body to know that they can be more triggering times. However, we don't always know exactly what the trigger is going to be, and sometimes it may catch us off guard. So I think it's important, again, to have some techniques to be able to cope with that. But really, I think one of the most important things is to be able to identify when you are having a flashback or a body re-experiencing, as opposed to it actually happening over again. So what designates cancer PTSD is that it can be similar to states of anxiety and depression. Some of the symptoms overlap, right? Like having a hard time sleeping, hard time eating, being irritable, crying. However, what really designates in the cluster of mood disorders, PTSD, is when you're having a re-experiencing of the traumatic event. So you would know that this is happening if, for example, I've had people tell me, I see the color red, and that reminds me of the chemo drug that made me feel nauseous and horrible and like bedridden. And so now when I see the color red, unexpectedly, I'll get totally nauseous physically. So not only is it just a memory, but it creates a sensory experience in the body. And that's very fascinating to me, right? It's like not only a cognitive remembering, but it's a whole body remembering. I've also heard people say the smell of alcohol wipes could be very triggering. And, you may have alcohol wipes in any situation, but for someone that's had to been poked and prodded so many times, it may be a reminder of the event. Also, certain tastes or smells can also be very triggering. So it's the re-experiencing. Again, it's not just a memory, and it's more of like you're there again in the moment. So common triggers, I've gone through some of these: anniversaries, follow-up scans. I don't know if anyone's heard the term scanxiety, the anxiety associated with scans or waiting for the results of scans, images, sounds, and smells. So it's really important to talk about this because, and I see this all the time, the intensity of the pain of potentially re-experiencing a trauma and getting triggered is so intense that people may start to avoid the trigger. So this man is saying, no, I'm not going to go to my annual follow-up because I don't want to know the answers. I don't want to get any more information. Ignorance is bliss. Leave me alone. So avoidance is one of the avoidance of triggers is one of the very big, classic signs of PTSD. But it's important, particularly when it comes to health, because if we are starting to skip appointments, we don't want to do that, right? And actually, there's a study that shows that patients with untreated distress are less compliant with treatment and surveillance regimens. So if you start to notice yourself slipping on your appointments, really check in with yourself and see, is there something that I'm avoiding? Is it too hard? Can I get more support? And let's see here. So cancer-related PTSD can occur in about 3 to 4% of patients who are recently diagnosed with cancer, and in up to 35% of patients evaluated after cancer treatment. So it's pretty common for this to happen. However, we will talk about prevention and how to hopefully prevent you from getting this, diagnosis or to have a full-blown episode. But yeah, I just put these stats there to let you know that if this is something you have experienced or are experiencing, that you are not alone. And I have here on the bottom, which I'll have another slide for, but post-traumatic stress, having symptoms of irritability and remembering and re-experiencing doesn't necessarily mean that you have a full-on diagnosis of post-traumatic stress disorder. So I know it's kind of confusing. Essentially, this one does not have the D. It's kind of newer in the literature. That's why it's a little confusing too with the stats. It's only more recently being documented as, hey, I've gone through this horrible illness and diagnosis, and, it's of course I'm going to experience distress. And so some of the symptoms of post-traumatic stress: feeling irritable, defensive, fearful, having a hard time thinking clearly, sleep problems, avoidance, loss of interest. So what I say is that if you are noticing you're feeling this way, or notice it in someone else, it's important to get support sooner rather than later. So when we think about what the risk factors and protective factors are for post-traumatic stress and post-traumatic stress disorder, like I kind of mentioned with getting support, we can actually reduce our chances of ever developing post-traumatic stress disorder or of getting better quicker by getting good social support, good emotional support as well, which will be in the next slide. But really having support of, I know Cancer Support Community's motto is, so no one faces cancer alone, right? I think that is kind of what it boils down to, is knowing that we're not supposed to go through this on our own. Also, it's really important to have clear information on your stage of cancer, your facts and your information for yourself, as opposed to generalizing and globalizing what you think, because we tend to catastrophize what the worst case scenario may be. And having with that an open conversation and relationship with your healthcare providers. Risk factors, I won't go through all of them, but of developing PTS is, history of trauma, a general level of stress, recurrence. Prevention, the key to lowering the risk of PTSD is prevention. So discuss your emotions, talk about how you're doing, find a support group. I know that there's so many in the community that we're privy to, which is incredible. Counseling and implementing relaxation exercises into both when you're receiving treatment as well as once you're done. So coping with triggers, when we do realize that we are in, so I guess this is twofold. When you are triggered, these exercises, these can help you to come back to balance, but also really it's planning ahead. It's again, I mentioned some triggers we cannot plan for, like seeing something red and all of a sudden becoming nauseous. But there are some situations that you may play around with, trying to see like, hey, it's been a year since I've been told that I'm cancer-free now. What do I want to do? I see these ladies lunching, and I know that that's, maybe the way that they are dealing with it. But I like to say that it could be good to start to just bring to our consciousness what is going on, so that we are the ones that could decide what we want to do and how we want to respond. Because the reason why we get eaten up is when we actually, our subconscious has taken over and we are not aware of why we're feeling this way all of a sudden. So the more we become aware and conscious of things to what is in our capacity of control, such as reminders, anniversaries, and it could be helpful to get ahead of the game in that way. Again, you can't prepare for everything, but just putting it out there. So there are some treatments for PTSD. I'm just going to go over them very quickly. Cognitive behavioral therapy, EMDR, which is an eye movement processing therapy. That helps. They focus on your eyes. So when you remember the trauma, they use eye processing to help you bring balance into the hemispheres of your brain, to help you to more easily process the memory that you're going through. And medication. So these are all evidence-based practices. I apologize for going a little bit quickly. I want to make sure we get through everything. And lastly, on this topic, in the educational piece, I want to mention post-traumatic growth. So this is one of my most favorite words in literature, in psychology literature, because trauma, again, as we mentioned, is such a loaded word, such a devastating word with so many associations, but it's also doesn't have to define us. It doesn't have to define us in a bad way. Again, it's kind of like, how can we flip the script and find, like this image is, some growth or some, dare I say, I don't know. Sometimes people even say they find new, beautiful parts of their life through hard times. I don't want to, again, assume or generalize anything for anybody, but I think that it's important to note that not everybody with cancer actually gets PTSD. Some people may even experience, even though they have distress, they may actually report improved relationships, new life experiences, making new life choices, changing their priorities, maybe getting a different job, new spiritual development, personal strength, empowerment, and changing the way that they think about their illness. So I'm going to pause here for a moment, Rebecca. I know we just have 15 more minutes and want to get to the mind body, but were there any big questions that came up in the chat?
No, we haven't had any questions so far.
Okay.
So if you want to just go straight right into the practice, that'd be great. Thank you.
Okay, great. Yeah, thank you. Okay. So that was a lot of information very quickly, and I apologize for the suddenness of it. I wanted to make sure we get through everything so we could get to this point. So nonetheless, we have arrived. So yeah, let's see. Thinking about the parasympathetic and the sympathetic nervous system that I mentioned to you before, the two parts of the autonomic nervous system, what automatically happens in our bodies. Sympathetic is the one when we're really activated. Parasympathetic is when we start to, I like to think of the P like the pause. We're like, okay, this happened, and now we're going to go down the hill and discharge that energy and start to relax. So that's kind of where we are in this lecture. We've kind of gotten a lot of energy, a lot of information, and now we're going to learn to bring it back down the mountain. So one of the best ways to actually discharge or release our energy, see this dog shaking off the water, is to actually shake. And I know this sounds maybe a little crazy. I know that we're planning on sitting here and do meditation, but in all of the workshops I've gone through on trauma and psychology and, mind body is to shake it out. And so I invite you guys to get a little crazy and creative here. And if you feel comfortable, maybe taking a stand. I'm going to just be sitting here because I'm cozy on my little meditation cushion, but it can be great if you want to stand and bend your knees and just start shaking it out. So let's do it together. It's kind of fun, right? I like that dance, Judy. I could see you. I like it. So as we do this, I'll talk to you a little bit. So we're actually shaking from the top down to the bottom. So we're actually kind of like this dog trying to release any extra energy that we have pent up, whether it's from the day, whether it's from me talking about trauma for 30 minutes, whatever it may be. Shake it out. And if you are standing, see if you could kind of have a little bounce and really feel into your knees and not your knees so much, your legs and your thighs, so that you're really feeling that grounding sensation that we started with. So yeah, let's just give it another few seconds here. And I want you to know that a good time to use this practice is when you're feeling really kind of like either on edge or just really hyper, or like the thought of sitting and doing a meditation sounds more stressful than relaxing to you. So this is a good way to kind of get started. All right. Beautiful dance, Judy. I like it. Okay. So with that, do you guys feel a little more like alive? Good. All right. So that is one skill. Another skill is grounding. So really the best way, the quickest way I think to access grounding is by kicking our shoes off and starting to put our feet on the floor if that feels comfortable and accessible to you. You could take your shoes off and quite literally just stand or place your feet on the floor. I'm doing it. And you could, as this woman has her feet in the grass, if you're ever in nature, the sand is great, incredibly grounding. Anything, soil, whatever it may be, get your feet a little dirty. And this will help bring your energy down as well. So when we feel our feet connecting to the ground, it could actually help us to release anxiety. It can help us to start to bring our body back to the present moment and to come back into one place in our body in this moment. So I'd like you to, if you haven't already, just start to feel really heavy in your feet. I know that we already started this in the earlier practice, but you could even tap your feet. You can wiggle your toes. Yeah, and just start to feel that connection. And as we did in the beginning of the first meditation, I had you, after we did the grounding, we took a few deep breaths. And then I actually asked if you could look around and move your head in all directions and observe any bright colors, any shapes. And you could actually, I'm going to move to the next slide, it's a better image. Orient yourself back into the present moment by doing this. So you may even consider counting all the blue things you see, red, white, brown, black. And do you see how I'm moving my head as I'm doing this? This actually can really help unwind us. And do it for like 30 seconds or something. Just give it a try. Try and observe and note either out loud, you're on mute, it's fine, what colors you see, or if any shapes stand out to you. And just pass through them. So see if this has any effect on you. And I like to throw them all out there because you never know which one will stick for you. But let's just give it a fair shot. And bringing your eyes back to the screen whenever you're ready. And I do want to let you know that this particular exercise, so we did the grounding, we did the feet, we did the legs. Squats are great for when you're like needing to discharge the energy from your body. This particular one is amazing for when you get triggered and you're like out of body experience. Where am I? Who am I? Am I in the clouds? I'm not in my body. I'm having a panic attack. So both of those actually, grounding and orienting, but I want you to keep this one in mind, the head and the counting. And you could even go through all of your 5 senses if you want to. You could count 5 things you see, 4 things you smell, and just go down the list. And I swear these are tools that you could pull out absolutely anywhere. You could, do them, whether you're receiving treatment or whether you're out at the grocery store and something reminds you of something, anytime, which I love. All right. So we went through grounding and orienting, and now we're going to make our way to centering. I'm just going to talk this one out, and then I'm going to get you guys breathing. So centering is another way of bringing ourselves back into balance by anchoring our awareness on something. So that something, oftentimes you'll hear teachers say, focus on your breath, right? That's like, and the reason why we do that is because it's always there. It's attached to us. So you're never going to forget your breath when you leave the door, So when you leave for work. So we always have it with us, which is an incredibly valuable tool. So you can focus on your breath if you need to anchor. You also, though, could focus on pretty much anything. And we'll get into this in our meditation, but having a centering phrase could actually be very helpful, or a mantra to help center our thoughts. So I really like breathing in, I am, and then breathing out whatever I feel like I need in that moment. So if I feel like I need more compassion, if I feel like I need more, I'm stressed, I need more peace, I'll be like, I am peace, I am love. That's kind of my go-to. For this topic, I think one good mantra could be, I am safe. I am safe. I am safe. All is well. I am anchored. So just taking a minute here to note if what you need in your life right now, it doesn't have to be the topic that we're talking about. It could just be like for today, for you right now. What do you need a little more of? And take mental note of that, please. All right. So we're going to keep that mantra in our back pocket. We're going to hop on over to our breath. So I'm sure some of you have probably heard about things like belly breathing and 3-part breathing, like our belly, our ribs, and our chest. I think what I want to mention for the topic of this lecture is focusing on our exhales. So if we think about the tiger, right? The threat, whatever the threat is in our life, the metaphorical tiger. When we need to fight the tiger or run away from it, we need a lot of oxygen, right? We need to take in a lot of air so that we could do what we have to do to survive. The thing is that we don't always need to be in that extreme state all the time. You can even take note of your breathing right now. So if you were to just take mental note, maybe putting your hand on your belly or something, and just note where the breath enters your body. And notice your inhales and your exhales. And just simply observe, are my inhales longer or are my exhales longer? Are they pretty balanced? Am I breathing through my belly? Am I only breathing through my chest? So this is all a whole bunch of self-awareness, right, that you probably usually don't do. So, not to start to breathwork diagnose ourselves, but I think it's really interesting. I know I learned when I took my breathwork training that I didn't realize how big I was inhaling in ratio to my exhale. My inhales were bigger than my exhales. So if you notice too, that you're constantly taking in so much and your exhales are shorter, that could be a sign that you're in an anxious breathing pattern. And that is something to keep in mind because we can consciously control our exhales to make them longer so that not only when we're triggered, maybe there's, a post-traumatic stress reaction or whatever, like it could be useful for that, the exhales, which is great if you're able to bring yourself down. It is more parasympathetic pause, but I think it's important to know if you're running in this anxious state to practice this on a regular basis, these exhales. Same if you're feeling, you're only breathing in your upper chest. Remember that a full breath comes from the whole diaphragm, which is the belly, the ribs, and the chest. So in that case, you may practice more belly breathing. Okay. So we're going to practice that. We're going to practice counting our inhales and exhales to kind of round out. And I invite you, if it's accessible to you and if you want to, to consider Padahurasana, which is breath balancing pose. So I got my hands here, and I'm going to bring my right hand under my left arm and my left hand under my right arm. And my thumbs are sticking out like the woman in the picture. This may be comfortable. This may be completely not for you. If it's not, please just release your hands back into your lap. And I'd like you to just simply observe. I know I feel pretty instantly some kind of a greater sense of calm in this pose. This pose is actually meant to balance our left and our right hemispheres and to actually engage that pause, the down regulation of our nervous system. And sometimes simply by just placing our arms in this position, we could feel a shift. However, as we conclude our lecture and our practice today, I like to invite you to come back to that comfortable seated or standing position and to tie it all together. So we're going to feel into our sit bones, rocking forward and back. Maybe feeling the connection of your feet to the floor. Lengthening our spine, stacking our shoulders over our hips and our ears over our shoulders. Finding a slight tuck of the chin in towards the chest. Releasing the tiny muscles around your eyes. Unlocking the jaw. And on the next inhale, we're going to inhale to a count of 3. So through our nose, we're going to breathe in for 1, 2, 3. Pausing if that feels okay to you. And then we're going to exhale for double. So we're going to exhale for 6, 5, 4, 3, 2, 1. Inhale through the nose to a count of 1, 2, 3. Pause. Exhale 6, 5, 4, 3, 2, 1. Inhale 1, 2, 3. Pause. Exhale 6, 5, 4, 3, 2, 1. 2 more rounds. Inhale 1, 2, 3. Pause. Exhale 6, 5, 4, 3, 2, 1. Inhale through the nose for 3, 2, 1. Pause. And exhale for 6, 5, 4, 3, 2, 1. Big natural inhale through the nose. And exhale out the mouth. Placing your hands back into your lap. Tucking our chin into our chest. And blinking our eyes open to look at the floor. Lifting our chin up and moving our head in all directions so that we slowly start to take in the room around us. To take in this present moment just as it is. Whenever you feel ready, we are going to blink our eyes back to center and fully arrive. So, thank you all. We covered a lot of terrain today. I hope that you picked up some new practices, a lot of hopefully new education. If you end up with any questions, please do let me know. I'll toss it off to Rebecca to see if there were any pressing questions in the chat. I know it's 6:34. I know we started a little late though, so it's a little tough to get through.